Division of Health Promotion and Behavioral Science, and I'm also co-director for the Institute for Behavioral and Community Health Studies and the co-director for the San Diego Prevention Research Center.
So what role has the Latino Caucus played in your work in professional development?
Well, the Latino Caucus has played a really important role in my life. It was the first organization that really exposed me to research in Latino health and the potential that one could have in terms of improving population health, specifically Latinos. So it really gave me a good bird's eye view of what was possible in the world.
And how did you get to where you are today? If you could tell us a little bit about your background, what inspired you to pursue your career in public health?
Well, I think what inspired me initially to pursue public health specifically was growing up in Imperial County, California, which is on the lower end of the agricultural belt in California. My parents are very strong community activists, and they would take me, a lot of weekends to go march with Cesar Chavez, with promotoras from federally qualified health centers, to really try and empower the community to take responsibility for their own health. And so I knew that led me to pursue public health specifically, but then it was really through mentorship that I received from researchers in the field that made me realize that really the best thing I could do was to improve the quality of research so that what we could do really could make a difference. It wasn't just things that would feel good to do, but rather would actually have a real impact on the community.
And were there any stumbling blocks along the way that you can share that with us?
Yeah, interestingly, I did have a couple of stumbling blocks. So when I had gone to school, I had started college, and then because of a variety of reasons, I eventually was kicked out of college after 2 years, my undergraduate degree, and I didn't really know what I was doing, took various odd jobs along the way, and then finally got a job actually as a school secretary, a high school secretary, and then moved up in terms of administration. And then I realized I really wanted to go back to school because I realized that if I didn't even have a bachelor's degree, I wasn't going to be able to pursue and realize my dreams. And so I remember writing an essay in order to reapply to go back to school, and I gave it to the English teacher at the high school, and I said, would you read this for me and would you edit it? And she did, and her first comment was, you write like English is not your first language. And that was the most disrespectful thing I felt anybody could tell me, because I was really struggling to want to pursue a higher education. But actually, I turned it into a positive when I said, I'm never going to let anybody ever say that about me again, and it really motivated me to improve my writing, and now my passion is writing. I think it's the gift that I've been given with a higher education, and I think it's what is helping me play a role in eliminating health disparities by writing and putting the evidence out there so that what we're doing as a community can really make a difference, and it's not just the things that might make us feel good doing it, but they're actually going to have a real impact on communities' health.
And what advice would you give Latino, Latina students interested in a career in public health, and what do you wish someone would have told you when you were pursuing your career in public health?
The advice I would give to Latino students is fairly consistent no matter what level they're at, and that is to work at your communication skills, whether it's your verbal communication skills or your writing communication skills, especially those who have the privilege of pursuing higher education. We sort of then, I think, have a responsibility to use that knowledge and education we've been given for a greater cause. And so that's what I would say. So even though you may struggle initially with writing or feeling like you can't express yourself, eventually it would come, but it does take practice. And so I recommend that anybody, Latino or not, write every day, because it's really the way that it's going to help you sort of have a really clear voice in terms of what needs to get done.
And what do you wish someone would have told you when you were pursuing your career?
I think I would have arrived where I am a little faster if I had been introduced to the field of research earlier. I don't think I ever thought that it was something that I could pursue because I wasn't necessarily interested in what I perceived as research, which was sort of the bench science or working in the laboratory. I didn't realize it was actually population research with people. And so I feel almost like sometimes I'm running a carrera because I need to catch up and I need to do everything I can before I pass to be able to, sort of set the stage for not only future students but also policymakers and the decision makers to be able to really affect change at all levels.
So last two questions about research. So what are some of the soft skills that researchers need to advance in their careers?
I'm not sure what you mean by soft skills.
Or any skills.
Okay. I would say some of the skills that a Latino researcher needs is, in addition to good communication skills, I think they need to have a certain degree of fortitude, strength, a little bit of a shield, because people will try and beat you down. But if you know what you're doing, if you're basing what you're doing on the evidence, then you have a legacy that you're sort of building on. I would say with non-Latino researchers and students who are interested in Latino health, I think it's really important to partner with other people who may know the community that they're working with, to really have good listening skills, because we don't always know the right answer, but usually community does. They just often don't know how to translate what they know into real action. And so I think that, that would be true for anybody, Latino or non-Latino.
And last question, what is different about public health research careers versus other research careers?
I think what makes public health research different than other research careers is that there is a degree to which it's practically relevant. So I think it's important to have science for science sake, because I think that falls into some of the things we do eventually in terms of the application. But I think public health does a better job of translating immediately what we know about evidence, what we know about theoretical models, what we know about appropriate measurement into real solutions that have the potential to have impact.